Did you know that many people encounter a problem in their spine because of degeneration, which is an age-related condition? So what exactly is degeneration of the spine and how do we prevent this? Hi, this is Dr. Lakshmi and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss and know more about degeneration of the spine and more importantly, how do we treat this condition? Joining our discussion today is Dr. Sayuj Krishnan, consultant neurosurgeon and spine surgeon from Yashoda Hospital's Malakpet. Welcome to the program, doctor.
Thank you.
So, doctor, degenerative conditions of the spine are one of the most common conditions affecting most of us. So to begin with, what exactly is this condition?
As with the aging, our spine, there is a significant amount of degeneration which usually happens at the level of the disc. Well, degenerative condition is a very common condition which presents with the low back pain and neck pain in patients. There can be various degenerative conditions which can lead to disc herniations, lumbar canal stenosis, degenerative spondylolisthesis. These are the common degenerative conditions of the spine. It can affect the neck, which is called the cervical spine, or the lumbar spine, which is the lower back. So basically the disc material actually composed of outer covering and the inner pulp-like material, which is called nucleus pulposus, and the outer ring called annulus fibrosus. These are all made up of, our body is made up of various materials like collagen material. The thing is that our body carries a significant weight of our body. Supports the spine acts as like a pillar supporting the weight of our head, the weight of our body. And over a period of time, with the aging and sedentary lifestyle and other things, it puts significant pressure onto the spine and then causes this kind of degenerative diseases.
So now that we know that this condition can affect anybody irrespective of their age or lifestyle, so once a patient presents to you, doctor, with back pain or some issues, how do we evaluate this patient?
Yeah, as you rightly said, lifestyle is one of the most common cause that can predispose one patient to low back pain and other causes. So I will start with what is their profession, where are they coming from, are they doing most of the sitting jobs like IT professional. I'll get a background of their profession. And then apart from this, genetic causes can also predispose one person to spine and degenerative diseases, conditions. When I assess, I ask them whether it is confined to the lower back or is it radiating to arms or legs, the duration of the symptoms, is there any numbness associated. I look in for is this just a mechanical lower backache or are there any red flags like radiating pain or any other comorbidities like malignancy, background and all those things. I inquire about the patient.
So doctor, do you think that all conditions would require some kind of surgical correction? If not, what conditions and surgery indicative?
90% of the patients who come with back pain to my clinic doesn't require any surgery as such. Most of them I advise for posture correction, physiotherapy measures and neck and back core strengthening exercises. Because as I told you, that the spine acts like a pillar supporting the weight of our body. And the posture correction is one of the foremost important factors. And strengthening the core muscles, weight losing measures, and patients like osteoporotic patients, I advise for calcium and vitamin D supplementation or further test to enhance the bone density, all those things.
So if we have to talk about surgical treatment for spine, doctor, I'm sure most of us would be scared. So what are some latest advancements that we have seen in this field, doctor?
Over the past 5 to 10 years, the spine surgery has advanced a lot. That includes robotic navigation, full endoscopic spine surgery. I focus particularly on full endoscopic spine surgery, which is a least invasive technique for the spine surgery in the present era, where insert endoscope, 0.8 centimeter incision, and then without the traditional methods of open surgery, we can dilate the muscles without disturbing the muscles, because the muscles acts as a posterior support, and without manipulating the muscle structure, we can enter into the disc space and remove the pathology from the herniated disc or the stenosis conditions. That is called full endoscopic spine surgery, and that is a latest upcoming trend in the spine surgery.
So talking about endoscopic spine surgery, doctor, are there any particular advantages a patient would be having with this procedure as compared to the conventional surgical procedure?
Yeah, the earlier open surgeries used to last for many hours. There used to be a lot of blood loss, and then the destruction of the tissue used to lead them to prolonged bed rest and other measures. But nowadays, with the full endoscopic spine surgery techniques, patient can even be discharged on the same day home, and then the blood loss is minimal, and the amount of anesthesia required is less, and the wound healing and other factors are very minimal in these conditions.
So as discussed earlier, that degenerative spine disorder is more of a lifestyle problem. So are there any lifestyle modifications that you would recommend to prevent this disorder?
Well, lifestyle modification, again, exercise is of paramount importance, for the core strengthening. Like when you go to gym, you go for the biceps, triceps, and other muscle exercise. But the core muscles, the muscles around the spine, which, as I told earlier, acts as a pillar of support for our entire body. So first comes the posture correction, and then comes the exercises to build the core muscles. And especially those who are prolonged sitting jobs and other things. After 20 minutes, you take a break, get up and do the exercise. Nowadays, we call it desk exercises job. Those who are in IT profession, just beside the desk itself, you can do some squatting exercises to strengthen the core muscles.
So before we wrap this episode, doctor, what message you would like to share with the audience out there?
People are in general afraid of spine surgery, but with the latest advances, we have like a full endoscopic spine surgery. These risk and complications of spine surgery are avoided to a maximum. And as I said earlier, focusing on posture correction and exercises, that comes as the first importance to prevent the health strain.
So thank you, Dr. Sayuj. It was wonderful having you here on the episode today.
Thank you.
So this brings us to the end of this episode. Remember that knowledge is powerful when your health is concerned, and I hope this episode was both enlightening and informative. And don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.